So, in the medical field, we talk about this rash called a malar rash. It's a rash that involves the cheeks, the central face area. And most of us in the medical field, when we hear that, we think of lupus. In fact, dermatomyositis patients will often present with malar rashes as well. So that's an area of the body that is involved in dermatomyositis and can be confusing to medical professionals, specialists, dermatologists, rheumatologists. Those patients might be misdiagnosed with having lupus. It can be confusing with seborrheic dermatitis, a dandruff-like condition of the face. It can be confused with eczema, very, very common, for example. And then, of course, there are these textbook findings like, involvement of the eyelids. Sometimes, though, again, can be subtle. It can be more swelling, not necessarily the kind of purplish hue that you learn about in the textbooks. And then there's findings in the back of the hands, also pathognomonic or classic for dermatomyositis. And again, the textbook examples are these kind of pink bumps that occur over the joints. But again, not necessarily in reality what we see. Sometimes they look a little bit more like eczema or like psoriasis, like changes over the hands. And then it's really a complex disease. We know that it involves skin from head to toe. So we really have to get patients in a gown and take a look at them head to toe, look at areas that are even hidden from the sun. So a lot of people think a lot of these autoimmune conditions are triggered by the sun, and that is in fact the case, but there are areas in dermatomyositis that don't frequently see the sun and involved are impacted.